Attacking Gullian Barre syndrome. What is Gullian Barre syndrome? The Gullian Barre syndrome is autoimmune disease. Gullian Barre syndrome is autoimmune disease. In the Gullian Barre syndrome, autoimmune polyradiculopathy occur. Autoimmune polyradiculopathy occur. In this syndrome, there is autoimmune polyradiculopathy occur. What is polyradiculopathy? In the polyradiculopathy, there is damage of multiple nerves. Damage of multiple nerve. There is damage of multiple nerve. Due to polyradiculopathy, this polyradiculopathy produces neurological symptoms such as weakness and sensory loss. Sensory loss and weakness occur due to polyradiculopathy. Gullian Barre syndrome is autoimmune disease. In this syndrome, there is autoimmune polyradiculopathy occur. What is polyradiculopathy? Polyradiculopathy is damage of multiple nerves due to the autoantibody against these nerves, and sensory loss and weakness occur. The occurrence rate of Gullian Barre syndrome is 1 to 4 per 1 lakh. 1 to 4 out of 1 lakh people may be affected and produce Gullian Barre syndrome. The males are affected more than female in the Gullian Barre syndrome. The Western adults are more affected than the Western children. The Western adults are more affected than the Western children. Gullian Barre syndrome. Gullian Barre syndrome is autoimmune disease. There is autoimmune polyradiculopathy. That is, autoantibodies are formed against the multiple nerves. As a result of polyradiculopathy, there is weakness and sensory loss. Ascending paralysis starts from the leg upward are the first sign of the Gullian Barre syndrome. Ascending paralysis. The ascending paralysis starts from the leg. The weakness and paralysis starts from the legs and begins upward and goes upward. This is the first sign of the Gullian Barre syndrome. In this ascending paralysis, which starts from the legs and goes upward, noticed, and they are associated with tingling, dysesthesia. They are associated with tingling, dysesthesia. Tingling and dysesthesia are also the symptoms of the ascending paralysis in Gullian Barre syndrome. The legs are more affected. The legs, that is distal extremities, legs are more affected in the Gullian Barre syndrome. The facial diaphoresis occur in 50% of the cases. The facial diaphoresis occur in Gullian Barre syndrome in 50% of the patient of Gullian Barre syndrome. Facial diaphoresis occur. The lower cranial nerves may be involved. The lower cranial nerve may be involved and they cause bulbar weakness. They cause bulbar weakness. When they cause the bulbar weakness, there is weakness and difficulty in handling secretion. There is difficulty in handling the secretion. There is difficulty in handling the secretions. And there is difficulty in maintenance of airway protection when there is bulbar palsy occur due to lower cranial nerve involvement. Difficulty in airway protection. Difficulty in airway protection due to bulbar palsy of the involvement of the lower cranial nerves. Bulbar palsy occurs. There is difficulty in handling secretion and difficulty in airway protection. Pain in the neck, shoulder, back occur in the early stages of Gullian Barre syndrome. There is pain in the neck, shoulder and back. Pain in the neck, back and shoulder occur due to Gullian Barre syndrome. This is the early symptoms of Gullian Barre syndrome. The early symptom of GBS, that is Gullian Barre syndrome. Pain in the neck, shoulder, back, and difficulty over the spine also occur. This is the early stages of Gullian Barre syndrome. 30% of the patient of Gullian Barre syndrome require ventilatory support. 30% of the patient of GBS requires ventilatory support. This requires ventilatory support. 30% of the patient of GBS require ventilatory support. And they are associated with facial and bulbar weakness. Facial weakness also occur. Facial and bulbar weakness occur, and 30% of the patient of GBS requires ventilatory support. During the first week of the symptoms of the GBS, loss of pain and temperature sensation occur. Loss of pain and temperature sensation occur during the first weeks of GBS. During the first few weeks of GBS, loss of pain and temperature also occur. But this loss of pain and temperature sensation is usually mild. Mild loss. This is usually mild. This is usually mild. Proprioceptive loss occur and severely affect the patient. Loss of proprioception. Proprioceptive loss occur. This severely affect the patient. Severely affect the patient. The patient of GBS are severely affected by the loss of proprioception in the early symptoms of GBS. The autonomic nerve dysfunction is also common. The autonomic nerve dysfunction is also common in the GBS, Gullian Barre syndrome. Autonomic dysfunction. Autonomic. In the autonomic dysfunctions, there is loss of vasomotor control, loss of blood pressure, and postural hypotension. There is uncontrolled BP. Uncontrolled BP due to autonomic dysfunction. And loss of vasomotor. Loss of vasomotor. Postural hypotension and cardiac arrhythmia also occur. Postural hypotension and cardiac arrhythmia also occur as a result of GBS. Cardiac arrhythmias may also occur. Pain is the symptoms of GBS, but this pain is acute, and this pain is self-limited in the GBS, self-limited. But the standard analgesics are needed. Standard analgesics are needed for the pain of GBS. Standard analgesics are needed for the pain of GBS, but this pain is self-limited. Self-limited. What is GBS? GBS is autoimmune disease in which the autoantibody against the peripheral nerves are formed, and they cause the several dysfunctions.